Foltabs 800 is a combination of vitamins that includes vitamin B6, vitamin B12, and folic acid. These vitamins are important for maintaining good health, and Foltabs 800 is used to provide them to people who do not have enough of these vitamins. You should take Foltabs 800 by mouth, with or without food, once a day as prescribed by your doctor. If it upsets your stomach, try taking it with food. Use it regularly to get the most benefit, and try to take it at the same time every day. The dosage is determined by your medical condition and how you respond to the treatment. Some common side effects of Foltabs 800 may include nausea, stomach upset, diarrhea, drowsiness, flushing, and numbness/tingling. If any of these effects persist or worsen, notify your doctor or pharmacist right away. Remember, if your doctor has prescribed this medication, they have determined that the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor immediately if you experience any serious side effects, such as mental/mood changes or unusual weakness. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And remember, if you're in the US, you can report any side effects to the FDA, and if you're in Canada, you can report them to Health Canada. Before you start taking Foltabs 800, make sure to tell your doctor or pharmacist if you are allergic to it or have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's important to talk to your pharmacist for more details. Also, let your doctor or pharmacist know about your medical history, especially if you have certain blood disorders such as pernicious anemia or other anemias. Keep in mind that this medication may make you drowsy, and alcohol or marijuana can make you even more drowsy. Avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. It's also a good idea to limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication. Drug interactions can affect how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Foltabs 800 include altretamine, cisplatin, levodopa, when used without carbidopa, folic acid antagonists, such as methotrexate, hydantoins, such as phenytoin, diphenylhydantoin, and pyrimethamine. Foltabs 800 may also interfere with certain lab tests, so it's important to let lab personnel and all your doctors know that you are using this product. If someone took too much Foltabs 800 and is having trouble breathing or passed out, it's important to call for help right away. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Foltabs 800 with others. Your doctor may want to do some lab tests while you're taking this medication, so make sure to keep all your medical appointments. It's best to get your vitamins and minerals from healthy foods like leafy greens, other vegetables, and citrus fruits. Some brands of this medication may also contain other ingredients, so it's a good idea to ask your doctor or pharmacist about what's in the one you're taking. If you forget to take your Foltabs 800, just take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take extra to make up for the missed dose. Make sure to keep Foltabs 800 at room temperature and away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When you no longer need it or it has expired, make sure to properly dispose of it. You can ask your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush medications down the toilet or pour them into a drain unless directed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.